Mr. Johnson, I'm afraid we're going to have to admit you for at least a couple of days. We need to get you back on track, but there's only so much we can do. When you're finally discharged, you must follow your fluid management instructions, renal diet, and medication directions. Plus, by placing an internal access such as a fistula, we can eventually remove the catheter. By removing the catheter, we can reduce the amount of potential exit site infections. If not, you may be re-hospitalized or worse.
I know. I'll try and do better. But in terms of a fistula, I don't want to be pushed. My body's gone through so much already. I am just not ready for another surgery. And I'm really scared of needles.
Mr. Johnson, we have looked at all of your lab results and you have advanced chronic kidney disease stage 5. This means that your kidneys are no longer working like they used to. You have 3 options. They are dialysis, hospice, or a kidney transplant. I recommend starting dialysis today.
I know people that have been on dialysis, and I don't know how I will manage. This is scary and too overwhelming to deal with.
I am being completely open and letting you know that you will have to change many things about your lifestyle. It can be done, and done effectively, so that you can still enjoy your life. Most importantly, you must follow the medical advice I give you and from the RNs, social workers, dietitians, and technicians from the dialysis clinic that you will be going to.
How are you doing, Mr. Johnson?
I guess I'm doing all right. At least I managed to stay out of the hospital over the last 5 months.
Well, that's great. That shows that you've been doing better with managing your treatment plan. Let's take a look at your monthly labs. You're doing great with getting enough of your dialysis treatments because you have good clearance levels. I know we talked last month about increasing your protein intake to help you with your albumin levels. How has that been going for you?
I've been trying to eat more chicken and more eggs, but I get tired of just eating chicken and eggs all the time.
I can understand that. I can provide you with some other options for protein-rich foods if you'd like. Based on your albumin level, this month we still need to work on getting in good sources of protein. We can add on a protein supplement to help you with that too. Looking over your weight gain from fluids, you seem to be gaining more weight in between treatments now that the weather is getting warmer.
Yeah, it's just so hot, and I'm just so thirsty all the time.
Well, let's discuss what foods may make you thirstier and review foods that are higher in fluid.
Oh, hi, how are you? Did you get your lab work back today?
Yeah, the results were okay.
Let me see your report.
I don't know where I put it.
Well, there is some grilled chicken and green beans. Do you want me to prepare dinner for you?
Each month we're going over the same things, it seems. Hospitalizations, lab results, the amount of people with catheters, fluid gain in between treatments, anemia issues, etc. I mean, there is only so much we can do, and it's up to the patients to do what we tell them they need to do. We can't go home with them and support them there.
In the end, you are right, but we have to do the best we can. We just have to hope that when the patient leaves here, they will follow through on at least a few of the things we frequently teach them about.
I have a group of patients every month that have lab issues. I review the labs with them each month and help them with how they can correct these issues. However, this group still has challenges because they don't seem to follow the suggestions I give them once they leave the clinic.
And the clinic as a whole is concerned about our number of hospitalizations and the total number of catheters. Plus, I am really concerned about patients' new dialysis. there is so much for them to adjust to. We need someone in the home supporting these patients because that is where the real challenges are. You know what? I was at a presentation recently that spoke about how home health can help with a lot of these issues.
Yeah, they get home healthy when they get out of the hospital.
Furthermore, the nephrologists feel home health should be set up through the primary care physician, and the nephrologists absolutely do not want to fill out any more paperwork.
The number one factor is getting a good home health agency. An agency that is going to help teach and monitor what we tell the patients in the clinic, but one-on-one in the patient's home. The one we listen to, called Direct Med Health Services, does just that. And their specialty for the last 13 plus years has been working with patients with chronic kidney disease. Their advisory board is made up of a nephrologist, a dialysis nurse manager, dialysis social worker, dialysis dietitian, and a dialysis patient. From what I understand, these patients probably had home health at one time, but they don't see the patients forever. The kidney failure does not go away unless the patient receives a kidney transplant. So there is a good chance that a lot of these patients don't have home health now. Plus, the presenter stated that there wasn't any paperwork needed from the clinic for their home health agency. They will get the primary care physician to sign for home health. If the patient has not seen a PCP in a while, they can send in a home doctor as long as the patient agrees.
Well, it's worth a shot. Let's talk about some of my most challenging patients, including Mr. Johnson.
Okay, I'll look into them. Who are some of the patients having trouble with their labs? If they don't have a nurse seeing them now, I will ask them if it's okay if a home health nurse can visit them for added support. How are you, Mr. Johnson?
I'm fine, but what is this about?
You've been coming here for a long time. We all want to see you do your best, and we are invested in your health. You have decreased your amount of hospitalizations, which is great. However, the nurse and dietitian state your labs indicate everything is not so great, and we really want to address them before you end up in the hospital or any other bad outcome. I would like a home health nurse to go to your house and see how they can add a level of support.
No, I'm fine, and I've had home health in the past. Plus, they don't do much when they come see me.
Well, the medical staff feel that by giving you additional support, we could get your labs in a normal range so you can avoid future health issues. The key is working with an agency that specializes in working with dialysis patients and does a good job. Here are 2 to 3 that you can choose from. Direct Med specializes in working with patients with chronic kidney disease. Would it be okay if one of them sends out a nurse to assess you and then they can go over what they can do for you?
Okay, that will be fine, as long as there's no cost to me and they come on my non-dialysis days.
Wonderful.
Good morning, Mr. Johnson. How are you today? I'm Vanessa, and I am here to start your home health care services.
I guess I am all right, but I do not need a nurse.
Sir, do you know about home health services?
I know I do not want different people in my home, and I'm seeing a nurse and doctor at the dialysis clinic.
I understand you have challenges regarding your management of diabetes and keeping your lab results in acceptable ranges. And we also have been informed that you seem to be getting a little weaker. I will help support you in managing these areas of concern and any other challenges after I ask you some questions. I am sure you don't want these conditions to get worse, including being hospitalized. Instead, we want to see your health improve. Some of the things we help with include helping you to manage your medications and your diet plan, as well as any needs for physical therapy and etc. These things will help you stay out of the hospital and remain in your home as long as you can.
Sounds like maybe I do need to have you around. Thank you.
You are welcome. Let us prepare for your examination with paperwork to get you started, and then we will complete your visit. We definitely want to work on improving your lab results. I see that your potassium and sodium intake are not as good as they could be, and your albumin levels are low. Where is your diet plan given to you by the dietitian at the hospital?
I don't know where it is, but I basically know what to eat.
Well, your lab suggests that you are not getting enough protein. Do you prepare your own meals? Who does the grocery shopping?
Rarely. My wife helps with that.
Do you mind if we speak to her?
Emma, this nurse wants to talk to you.